After you undergo ACL reconstruction, when can you start putting weight on your leg? In this video, I answer that question from a viewer going through the recovery process after his ACL surgery. My name's Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. This video is part of my Ask the Doctor video series based on questions that you've left me in the comments to the videos on my channel. ACL reconstruction surgery is very, very common these days. Hundreds of thousands are done every year across the world, typically in athletes and active people, even up into the 40s and 50s these days. Surgery most of the time involves replacing that ligament with tendon or ligament from another part of the knee, sometimes with a cadaver graft to basically rebuild or remake a new ACL. It's a straightforward surgery. It's an outpatient surgery. The answer to when you get to start walking after that surgery is not always crystal clear. It depends on a few things. One, any other damage that was addressed at the time of that surgery, and two, a little bit based on surgeon preference. As for the first part of that, other injuries, the big one would be a meniscus tear, and specifically a meniscus tear that the surgeon fixed with stitches at the same time they did the ACL reconstruction, basically sewed it back together with stitches, a meniscal repair. In that setting, the surgeon may keep the patient non-weight bearing, completely non-weight bearing, or at very most just touching the toes down, but no real pressure on it for up to 4 weeks. If it's the meniscus tear that you trim part of the meniscus out, then it probably wouldn't change and it would just be like the primary ACL. And if it's just an ACL or an ACL and just trimming out part of the meniscus, then a lot of times, and I used to do this as well when I would do these surgeries, is that I'd let the patient put some weight on it, maybe up to about 50% body weight on it immediately, and then progress that over the next 2 weeks or so, maybe up to about 4 weeks. But again, that's where a little bit of surgeon preference comes into play. I know there are some orthopedic sports medicine specialists out there that do limit weight bearing for a couple weeks. Some are much more aggressive like I was, allowing some weight, but that meniscus repair is one that a lot of times the orthopedic surgeons will limit weight bearing. The other potential thing would be is if it was a multi-ligament knee injury, ACL, PCL, or ACL, MCL, or ACL, MCL, LCL, one of these combination injuries, that might be a longer period of non-weight bearing. And then again, surgeon preference depends a little bit. Just some are naturally more aggressive than others. There's going to be an aggressive amount of work with physical therapy, not just in your weight bearing, but also getting your range of motion back early. But the rehab is not absolutely everybody does it the same way. But the big part is the other associated injuries that are addressed at the time of surgery. But it can be worth talking with your orthopedic surgeon as well about what your potential weight bearing options are going to be if it's just an ACL or depending on what other injuries there are. Now, if you have an orthopedic injury and you want to hear about options other than surgery and other than cortisone shots, click the link in the description under this video. You can fill out the contact form to learn more about scheduling an appointment with me. I'd also love to hear your experience with your injury. You can leave those in the comments below. Just understand, if you leave a question in the comments, I can't offer you medical advice, but I might answer your question in a future video. Make sure to subscribe to this channel, click the bell to be notified when I release a new video and when I start my monthly Ask Dr. Geier live shows. Thanks for watching. I look forward to helping you feel, look, and perform better than ever.